Zoom, it's the next best thing to being there.
I think it is the new thing to be there.
I see Mayor Steve Calloway is with us as well today. Oh, what a great bunch.
So we are at 9:02. We have a great group. We've got about, looks like 38 people still signing in. Welcome. My name is Marisa Zapata. I am the Strategic Initiatives Coordinator for Washington County, Housing Authority of Washington County. And I'm super excited to be here. This is my first HAC Housing Forum. And I'm really excited. I think we've got a great morning for all of us. We are going to start with a Zoom poll just to kind of get everyone involved and to get a feel for where we all are this morning. So our theme for today is homelessness in Washington County, major contributing factors and paths forward. The question is, how well do you feel you currently understand the issue of homelessness in our community? So we'll leave this up for about 1 minute so people have a chance to answer. And then we'll kind of go through and see where everyone is before we get started today. A couple more reminders while you're answering that. Make sure your microphone is muted, please. We're up to 40. It would be a little bit of chaos if we weren't all muted. So please take a moment and make sure you're muted. We will have time at the end of each session for questions. So you can put your questions in the chat. Jacob Foyet, Jacob Rosales and I will be tracking those, and we'll keep track of those for the Q&A for about 10 minutes at the end of each session. So please go ahead and use that chat and drop your questions in there. I want to remind anyone who's not familiar with Zoom. I feel like we're also familiar with Zoom now that this is just rote, but there's a button in the top right corner of your screen that can switch views. So if you want to switch from gallery view, where you see too many people, to speaker view, that option is in the top right corner. And lastly, don't forget to order your lunch. We are hosting lunch for our invited guests today. You should have received an email from DoorDash, because that's how we're hosting this lunch, from Jacob Foyet with instructions. There's my cat, sorry. So whichever email account you received that email in, that's the account you'll use to register for that DoorDash group. So get that ordered and let Jacob know if you have any questions. I'll go ahead and put Jacob's email address in the chat in just a moment. So let's see, we've got 12 participants so far. People are holding back, but that's okay. It looks like most of us today have some basic knowledge or really solid background in this work. So I think that's great. I think we've got a good morning of learning a little more ahead of us. And with that, I am going to turn it over to Katherine Gallian. She is the HAC chair, and oh, I've got too many windows open. And she will be hosting today. Katherine, you want to take it away?
Thanks, Melissa. Thank you for putting all of this together. And as the chair of the Housing Advisory Committee, I am honored to welcome you all today to this event. The committee and staff have put together a really exciting group of panelists to dig deeper into the major contributing factors to homelessness in Washington County, and to explore together our paths forward. So thank you so much to our panelists for being here today and sharing your knowledge and experience with us. And thank you to the Housing Authority staff for putting together what promises to be a very informative morning. I'm really looking forward to it. Thank you to our elected officials for being here with us this morning, our HAC members, our Housing Authority board members. This is an amazing group, and really looking forward to digging into this topic together this morning. And while we would all much rather be together in person, this is a pretty wonderful turnout for the Zoom forum. And thank you so much to especially Melissa and Jacob for making sure all of the technology works this morning and putting all this together. So thank you for being here. And I'm going to go ahead and turn it over to Comey for our official welcome.
Well, good morning, everybody. It's my privilege and honor to officially welcome all of you again. I too want to acknowledge the elected officials, Housing Authority Board of Directors, and the HAC members, and especially the Housing Department staff. There's lots of us, but I want to just speak out Jacob, Melissa, Josh, and all the managers here today. So thank you for your time this morning. Thank you. Well, sadly, this is our second year having a virtual forum, but that should not change anything. We have a very, very meaty subject that we want to leave today with some knowledge, some next steps, and also, you know, more energy to tackle these issues for our community. Today, we want to just pause and think about the issue of homelessness, the complexity, and also the way forward. There will be a lot of thought-provoking the discussion today. It will be interesting and helpful for all of us. I also want to acknowledge that the work around housing is immense, it's tough, and there's not a whole lot of easy wins. But with your support, we think we can make a difference, a big difference for our community. Over the course of last year, the housing department work has tripled, as has our budget. I am extremely proud of our team. Our budget is 130 million. A year ago, it was 40-something million. Our housing team, I couldn't be prouder. This is work that it takes more than a village to do. And I am just so proud of our team. Allow me a moment to just go over a few highlights of our past year. First, the Landlord Compensation Fund. So our team put out $25 million to landlords in this community, so keep people housed. This was a program from the Oregon State Legislature and the Oregon Housing Department worked with housing authorities in partnership to get that money out. And we just planned ahead, got the money out very quickly, very proud of that work. We also maintain our federal programs for Section 8, which is the Housing Choice Voucher, for low-rent public housing, for continuum of care. And we got new vouchers for emergency housing vouchers for homelessness and new upper dollar, American Rescue Plan, ARPA. We also are working on a large-scale redevelopment of our portfolio, 332 units of housing that we are going to rehab, over 40 million in new in rehab. So that will stand these affordable rentals that typically are charging about 50% of market to stay viable for a very long time. The Metro Affordable Housing Bond is underway. I think Washington County, we are leading the region in terms of implementing that. So very, very happy to know that. Supportive housing program is also underway. It was not in existence a year ago, and it is moving forward. We are hiring staff, getting the work done, getting contracts out. And Move to Work, which is the HUD's demonstration programs to allow for innovation. We have been selected out of 3,400 housing authorities in the nation. There's about 80 that have some sort of move to work, and we are among that elite group. And this wasn't true a year ago. So we want to thank County Administration, Health and Human Services, Facilities Department, Sheriff's Office, Legal, and all the other county departments that have worked with us, partners with us, COVID relief programs, Safe Sleep Village, and comment programs. This is tough work. So we look forward to the upcoming year. There are going to be challenges, of course, But with the support of all of you in this room, we are not deterred, and we think a year from now, there'll be more progress to report. Thank you. So thank you all. So with that, I hand it over to Chair Katherine Harrington.
Thank you, Comey, and thank you, Katherine, for kicking us off today and helping us all appreciate where we find ourselves here in 2021. Thank you all for joining us. Some of you are real experts in this field, so I hope the program of today will provide you a bit of shot in the arm and a motivation to keep doing the tremendous work that you're doing. Thank you to everyone who serves on the Housing Advisory Committee. You really do some incredible work for us, and we are grateful for it. Today, you've already seen and heard that we have at least 3 members of our county commission here. I'm joined by Commissioner Pam Treese and Commissioner Nafisa Fai. Our other 2 commissioners had some other obligations that have impacted them today. It's an exciting time for us to serve our community. New homes are coming online. We have expanded services and expanded service availability that has been crafted with such intentionality along the lines of being culturally appropriate and culturally sensitive. We couldn't do this work without each and every one of you. Thank you for helping us get better, but also thank you for helping us grow our capabilities. You know, Comey put it in terms of the dollars and cents, going from 40 million to 130 million in 1 year. But we also have a much larger workforce and contracted service suite to deliver these capabilities. But many of you already know this stuff. You helped advocate for the 2 voter-approved finance measures that have helped enable a lot of this work. And I am grateful for that. We need your help now. I must ask, really make an appeal. There is a bit too much, in my opinion, too much negativity going on around government and the services that government provides. We are a safety net government. There's no argument there. We need your help to champion the fact that we have these accomplishments. So I cringe to ask you to do something more, but please just make sure that your friends are aware of the great availability of new affordable homes, as well as the supportive services to help everyone in our community thrive and be on a positive path. Because whether we realize it or not, our day-to-day quality of life is impacted by every person in our community. And we need more people to appreciate that fact. Everyone matters. I know you know this, and you certainly matter to the Board of Commissioners and to our staff. So thank you so very much for contributing your time today, but throughout the course of the year, so that we can do better together. Thank you. And I look forward to the really exciting panels that have been put together for today. Let's learn.
Thank you so much, Chair Harrington, and thank you for your kind words and for your leadership around the issue of housing and homelessness in particular. Thank you so much. Okay, so without further ado, we'll jump into our very first conversation. So this is our first conversation of the HAC Forum, is with Dr. Marisa Zapata and Andy Silver. So I'm going to just go a little bit through some housekeeping first. Our theme for today is homelessness in Washington County, major contributing factors and paths forward. And we are so fortunate to have our amazing slate of experts joining us today. We've broken our conversation into two portions. So we'll have a little bit of time to dive into to some of the thoughts. We'll want to make sure that we're keeping all of our microphones muted during the moderated conversation. But we will, at 9:50, we'll pause and hold a Q&A session. And you are also welcome to drop questions in the chat. So if you've got questions for one of our speakers, go ahead and put that in the chat. Jacob is going to be monitoring that for us, and he'll collect all of those questions. And if we don't have time to get into our questions at 9:50, we can also hold some of those over for our last Q&A session that'll happen just before lunch. So our two panelists for this session are Andy Silver, who has worked on ending homelessness and increasing access to affordable housing for over 15 years. I've known Andy for, I think, all of those 15 years. He's now the Chief Operating Officer at Vancouver Housing Authority, where he also serves as the Executive Director of Columbia Nonprofit Housing. The Vancouver Housing Authority and Columbia Nonprofit Housing are both notable for their innovative housing and support services for seniors, people exiting homelessness, and people with complex behavioral or physical health conditions. And our second panelist this morning is Dr. Marisa Zapata. Dr. Zapata is an associate professor of land use and planning and the director of the Homelessness Research and Action Collaborative at Portland State University. Go Vikings. As an educator, scholar, and planner, Dr. Zapata is committed to achieving spatially based social justice by preparing planners to act in the face of the uncertain and inequitable futures we face. Dr. Zapata has been on the forefront around much of the research work being done around homelessness in our community. So thank you both so much for being here this morning. Our first question, work to address homelessness feels like an incredibly timely topic, but homelessness has been an ongoing issue in our community for decades. How has the state of homelessness evolved over the last 10 years? And we'll start with you, Andy.
Well, thank you for having me this morning. This is a wonderful and timely convening, and it's an honor to be part of it. You know, I think it's a really interesting question. I think there's a lot of things that have remained the same around homelessness over the last decade, but I think there are some important things that have evolved, and I'd highlight two. One, I think, is the political profile of the issue and the effect that that has had. So as this issue has sort of risen to the top of the community's mind in the metro region, there have been sort of disagreements on strategy and sort of controversy that has come with that. And I think that for the first time, at least in my time in this line of work, the sort of the details around strategy and how social service providers approach helping people exit homelessness has become politicized, and there are differing opinions on that. So I think the nature of doing the work has changed a bit. But I think the other big change has been as we've seen the cost of housing rise rapidly in our community. I think the diversity within the population that experiences homelessness has grown, and it was always, I think, a pretty diverse population in terms of need and families versus individuals, and people with multiple physical and behavioral health challenges versus people who didn't have those. But I think what we're seeing now is that on one end, those with sort of the most acute health conditions, sometimes co-occurring, that population has seen more complexity in the challenges that they're dealing with. And at the same time, with the rising housing costs, we're seeing on the sort of the other end of that spectrum, more and more people with higher incomes who are also experiencing homelessness. So the diversity of what's needed, I think, has expanded as well.
Thank you. Dr. Zapata, do you have anything you'd like to add to that?
Yeah, first of all, thank you so much for saying my name correctly and getting the actual full aspects of it. I really appreciate it. You know, I'm going to say Andy just said a lot of the things that I would say. I think particularly what's always interesting in spaces like this is that it is this question of what is the data actually telling us that changed and what is being discussed in the public eye for the first time. And so it's always trying to play a little bit of catch up. So I would say one of the things that I think is pretty new in the last 10 years to the face of the public is the idea of housing first. Right, and that housing is the primary solution for homelessness and the way that we prevent homelessness. I think for a lot of the service providers as well, really owning that and leaning into that has been fairly recent. I'm going to put a lot of links in the chat that have a lot of the data that's going on around the region. I mean, around the country, the state, and the region. It's not all one link. I put little colons, so hopefully that'll work. We did a study a few years ago to really get at these different ways of thinking about homelessness. And I think that's the other thing that's happened in the last 10 years is really asking when HUD says people are homeless, when the Department of Education says people are homeless, when the National Institutes of Health say somebody is homeless, they're all relying on slightly to dramatically different definitions. And so, you know, if I look at one population, homelessness has gone down. If I look at another population, it's gone up dramatically. And we're also, I think, for the first time, really trying to think about regional interactions. So I serve on the Multnomah County Continuum of Care. And when I get a shiny report that says family homelessness, doubled up population has gone down in Multnomah County, my first question is, well, what's gone up in Washington County? Because y'all's rates of doubled up reflected in the schools data are some of the highest in the state. So what we have seen is there was a spike in the late, in 2007 to 2010 with people experiencing homelessness. We've seen some ups and downs since then. Lately, there has been an increase in the point in time nationally. But again, it's always trying to figure out, have we changed definitions? Have we changed counts? What is actually driving this understanding? Certainly everyone has seen more people who are unsheltered, but that population tends to be the smallest portion of the number of people experiencing homelessness. And so trying to understand and put that into context, I think is really important. So I think a better understanding of the data and what it can tell us, coupled with, I think, recognizing that this is not the worst that it has been, which isn't a good thing, right? It's still bad, but it is not the worst it has been, which means that we can make progress.
Great, thank you. And that's a really really good segue, you know, as we talk about the political profile that's driven by kind of the visibility of unsheltered homelessness at the moment. Our next question for both of you is the result of housing instability and homelessness. Folks living outside and in shelters is so much more visible than the factors that lead up to it. So drawing on the experience of your work, can you kind of please describe the one or two top contributing factors that lead to housing instability and homelessness? And we'll start with you this time, Marisa, if you don't mind.
Okay, so the number one cause of homelessness is lack of access and stability to housing, right? That is it. That is period, full stop. We know homelessness rates go up as housing market rates go up. The more dramatically housing rates go up, the more people we have who are homeless, the bigger gap there is between rents and income, the more homelessness we're going to have. So it's not particularly rocket science. The thing that I like to think of is the other contributing factor falls into these ideas of protections and supports for tenants. And so that includes things like eviction prevention work, as well as things like making sure that people who need mental health care or other kinds of healthcare support to stay in their housing have access to that. So I'm really trying to work on helping people think about, since I'm a land use planner, if you were going to approve a development to go in, you would demand that there were sewer lines going in, you would expect there to be a park, you would expect there to be electricity. Why are we not extending the same kind of thinking to the idea that if we want people to be able to stay in their housing, they may need help to do that, right? And so, we know that the housing is essential to people being able to live their full lives, including managing multiple jobs or managing health care. And so if we think about that as a prerequisite to housing, right, that is part of how we think about building or increasing our housing supply, I think that helps a lot. But it's housing, y'all. It is just housing. I know it breaks everyone's heart for some reason. It doesn't feel like it should be simple, right? It does not feel like it should be simple. And so you're like, wait, what? So yeah.
So,
Thank you, Dr. Zapata. Andy, do you have any comments?
yeah, just very much agree, but I want to take a couple minutes just because I think that, or my hypothesis is that not everybody here believes that. So I want to talk a little bit more about it. So I think one of the confusing things when we think about contributing factors is that we generally think about, if I'm speaking to a person or a family that's experiencing homelessness, what is it about that's going on in their lives? Or somebody might say, well, why aren't you talking about mental health? Why aren't you talking about substance use disorders? Why aren't you talking about domestic violence? And certainly nobody's denying that those things are present at higher rates in the populations that experience homelessness. But we're talking to policymakers today, right? And what we're talking about is the community level. So what drives homelessness on the community level? And the thing is that lots of people who experience mental illness, for example, don't experience homelessness. And the rates of mental illness have not changed much over the time period where we've experienced rises in housing instability or homelessness. So back to the point the doctor was making, the thing that drives it on the community level, and this is like really not up for debate anymore, is the cost of housing and the rate of the increase of the cost of housing. So when we think about community level solutions, this is getting back to also sort of the politics getting involved. Sometimes what's happened is we see the community level rise, and we look at solutions that providers are doing for individuals and families and say those solutions must not be working because the rate overall is rising. And those are two different things. So that's like the best analogy I've heard is the firefighting analogy. Wildfires are increasing in the West, right? We're not blaming the firefighters and their techniques for putting out fires on the fact that we're having more wildfires, because while we might not all agree on why we're having more wildfires, I think we understand that the contributing factors to that is different than what works to put them out. Doesn't mean we shouldn't analyze our techniques of putting the fire out, and if there are better ways to do it that would make the fires last less long, that sort of thing, we should improve those. But it's not going to change the overall rate of how many fires we're experiencing. And I think that's the challenge that we have right now is, if we want to tackle this on a community level, we got to go and deal with the fact that housing costs is what drives homelessness.
Thank you for that. That is a great analogy. Okay, our next question is again for you, Dr. Zapata. You've spoken before about how racial inequity in housing and services is a key piece in homelessness for people of color. Can you tell us more about this and what needs to change to address these inequities and their impact?
So I'll share out a TED talk I did about the origins of homelessness. And I think it's really important to keep in mind that homelessness reflects all of our systemic failures in this country, right? And that's why I think it does feel overwhelming. What Andy's getting at is that there are so many systems that aren't working, the primary one being the housing market. And so when you think about who had access to housing and the idea that it is a market from the foundations of this country, well, I would say, you know, half of us on this screen would not have been allowed the privilege of owning a home, right? The foundations of the country. And so we continue to see that being built upon. We continue to see the racial disparities of for people of color that were started at the beginning of the country continue today. We know that in Oregon, Black residents are 3 times more likely to experience homelessness, and Native Americans are 5 times more likely to experience homelessness than people who are white. In the country, we see that I think it's 30% of people who are Black, represent the people experiencing homelessness, but they're only 13% of the national population. And so we cannot solve homelessness or prevent homelessness if we are not talking about structural, institutional, and interpersonal racism. I think that that is the other thing that also makes people go, oh my God, now we have to talk about race and homelessness. This is going to hurt my brain. I am very sad. And that is very true, right? I am not the fun person to take to a cocktail party anymore. But you know, so I think it is thinking about the fact that where are these disparities particularly acute for people of color, and how do we address them in particular? And that can help organize the policies that we want to go after or the way that we might handle them. So when I think about, you know, one of the barriers for accessing housing, we're thinking about debt load as well as interaction with the criminal justice system, right? So if a landlord is looking at a profile, those are things that we know show up more for people of color. And so if I'm thinking about what to focus on in terms of getting people into housing, addressing those 2 issues with landlords might be what I want to look at the most. The other huge thing that is happening right now is that there is such a deficit of mental health care providers in this state. It is acute. If you have tried to find a therapist for yourself, you have probably encountered barriers in doing that. We also know that within healthcare, practitioners of color are the most important within those subfields, right? And so having a healthcare provider, a mental health care provider of color is essential to meeting the needs of people of color who are experiencing homelessness. That gap is even wider. And so my biggest concern right now is actually that we are going to face a long pipeline in recruiting, training, and then also retaining practitioners of color to do this work. And so I think about that as one of the fundamental things. I think the other thing is that we see this rise in conversation around culturally specific services, which I love, right? Talking about meeting people, how they are, who they are. But I think we're still not comfortable recognizing that it's not just about having someone who looks like or sounds like the person who's being served, that there are fundamental ways in which we practice, in which we have our prioritization system for who accesses services, fundamental ways in which we might interact that are not culturally familiar or culturally supportive, expectations around discipline and how discipline works out. We know that Black boys are more likely to be disciplined in shelter than white boys for some of the same infractions. And so that's real tough work. And I think having that organized even is really, really challenging.
Thank you.
I can talk about this for hours, so come have coffee with me.
I think that's why you would be the perfect cocktail party invitee.
Y'all, when I have cocktails, I want a break.
Okay. Andy, do you have anything you'd like to add to that?
I think maybe just very quickly, one of the ways that the disparities that we've created, I mean, housing is an interesting thing when we talk about disparities, because basically it was perhaps the primary tool originally for racial oppression and segregation, et cetera. And now we're trying to transform it into a tool that reduces those disparities. And that's a tough thing to do. And one of the ways that I think it in one of these hidden areas, I would just mention, is screening criteria for apartments, whether they're affordable or otherwise, and looking at criminal criminal history, evictions, all of the things that are normally looked at have a very disparate impact on people of color because of some of the system, issues that have been brought up. So just wanted to add that.
That's a really good segue actually to the next question, which is the Vancouver Housing Authority has a reputation for doing some very innovative work around low barrier housing. Can you tell us about some of your policies or initiatives that Vancouver Housing Authority has implemented to rehouse high-need people, for example, those with justice-involved backgrounds? Yeah,
so I think I would say, so there are two ways to look at this, and I think both should be looked at. There's, sort of the across the board portfolio of how affordable housing, of housing choice vouchers and other type of vouchers, and can we lower the barriers in those existing programs and housing. So that's things like we were just talking about, screening criteria. In voucher programs, there are some federal rules that we don't have control over on who gets screened out, but there are also then local rules that we do have control over. The other piece of this, and I think what, and just to be honest, Vancouver Housing Authority is very much still in the early stages of our journey on that piece of it, and we still have a significant amount of work to do. I think the area where we've been able to progress a little farther is when we think of low barrier housing in the sense of supportive housing, housing first model, housing that's designed to serve those with sort of the most complexity of needs, so that the supportive services have to be sort of integrated into the housing in order for that model to work. And what we've done there is we've tried to increase both scattered site options with rental assistance programs, as well as site-based developments. For the scattered site, we've taken some of our vouchers and prioritized a partnership with a Medicaid program that provides supportive housing case management. I'm not exactly sure where this is. I believe Oregon, we got that program through a statewide Washington State Medicaid waiver. I believe Oregon is working on that now, or might just have gotten something similar. So that opportunity might be coming out, but it's a way to sort of take a housing resource and integrate it with support services to create supportive housing. And on the site-based side, we've done the same thing, but with developing buildings. And the point of there are pros and cons to each approach. And the way that I think we've approached it is let's do both and have client choice to the which is sometimes more on paper because it's all full most of the time, but at least we have both models available. And the advice I would give to other housing authorities or other communities looking to do it is that don't, and these are from from mistakes we've made and learnings we've had, is you can't just change, for example, a priority of who gets in. You have to really change the underlying systems. And that's because the underlying systems of how we create housing and how these rental assistance programs work excluded historically these populations. So you have to almost rebuild it with this population in mind. So, when you're building the apartment building, we've looked for architects who can use a trauma-informed design approach. And, from sort of the paint colors to how you're building the building, whether you have controlled entry versus garden style, how the services are delivered, all of that should be sort of formed with the population in mind, and hopefully with some input from the population in order to end up with a successful program that's going to have high housing stability rates.
Thank you. Okay, next question. And we'll start with you on this one too, Andy. Homelessness has continued to grow throughout the metro region, including Clark County. With this increase, how should we envision regional coordination around areas like shelter, permanent housing, and encampment management?
Yeah, this is a tough question coming from the perspective of someone over in the Vancouver, Clark County part of the metro region, because I think the state line has been such a barrier. And not to, not that we don't all talk to each other and share information, but there are all of the, Clark County has a little bit of a chip on its shoulder because we feel like, we don't get the full benefit of being part of the metro region because a lot of the stuff can't cross the river and we have to go up north. So I think that I'm interested in what others feel on the regional coordination. I would just say that at the very least, I think ways increasing opportunities for us to share learnings across the region, like today is a great example. And having like learning cohorts, this is also very tough work. Our case managers, service coordinators, property man, it is tough work, and having opportunities, to provide support and ways for learnings and all of that, I think across the region would be really helpful.
Thank you. Same question to you, Dr. Zapata.
I guess there's a difference between what we could expect and what we might want. And so I'm going to talk about my fantasy because I think it can be achieved. First, I just want to really emphasize what Andy said. It is so hard to talk about housing markets, job markets, all the things where we have an arbitrary barrier that profoundly affects how we practice. I don't know what the solution to that is. It's the reality of our practice, right? We have 2 state legislatures, 2 governors, a whole cacophony of local jurisdictions. And I don't know what we do, but it is vital that we're at least keeping our eye on what is happening on both sides of the river. In terms of the regional conversation, and so I'm going to talk about the Tri-County area and Metro, we have to figure out how we are going to effectively hold one another accountable for the provision of fair housing laws, right? So how are we going to actually make sure all jurisdictions are providing affordable housing and affordable housing access to all of our residents? We cannot have places, and since I am not in that county, we can talk a little bit of mess about Lake Oswego. We cannot have Lake Oswego, right? Like we cannot have places that are like, we're not having the affordable housing. Metro has had the power to do this, to be more of an enforcer, and they've chosen not to. And so I think it really comes down to the counties and the local city jurisdictions to really sit down and say, what is our housing strategy to make sure that we are getting the units out across the region in a way that allows people to stay in place if they want to, or allows them to move to different access points around the region? And so that's what I really think we need to be looking at. That is the most important thing we can do for homelessness. When we get into the discussion about shelter and alternative shelter, that is the big thing in the news right now. I am overwhelmed by it. I am so confused at what everyone is proposing we do or not do. Every other day, there's a new op-ed by people who know nothing about these topics, by the way. But everyone's got a proposal on what we should be doing. And I think that from an empathetic perspective, I understand the sense of urgency. We have been watching people suffer for such a long time, and it is really hard. The less sympathetic perspective is that some people just want people to go away, right? And so I think we actually need to pay attention to those motivations when we're having this conversation. When I think about what is necessary regionally for alternative shelter and for shelter, we do need to have options across the region, right? It is not helpful to the person experiencing homelessness. We know that most people, when they become homeless, stay in their neighborhoods, right? So they're living in cars in places that they know, they're living in abandoned buildings in places they know, or they're trying to double up to keep their kids in the same school district. And so I think that keeping in mind that we want people to be able to more or less shelter in place, right? Shelter where they're from. At the same time, I just want to caution against overly investing in a shelter system. because we have seen across the country, the more that we invest in shelter or alternative shelter, the less we end up investing in the solution to homelessness, which is housing, right? And we can look at the East Coast as our example for what happens when we do that. Homelessness will become less visible, but it does not go away. And so you're effectively not actually helping your constituents or your community members actually end homelessness. So I think that that's what we want to do. I do think that it does require regional coordination, and kind of accepting that we all have to carry a load for that, and really think about how do we make sure that we are providing access to the housing and when needed, some of the shelter. I'm not gonna, I know everyone gets into a fight over who's carrying the biggest burden for shelter and programs and services. That is not my dog. I don't have a dog in that fight. I think the other thing is, of course, services themselves. I know that one of the big questions with SHS, particularly for provision of culturally specific services, is whether it is more advantageous to ask the culturally specific providers who've been most active in Portland and Multnomah County to simply expand services into Washington County and Clackamas County, or whether it is to grow your own, or whether it is both. And that is not an easy question. And since things need to happen rapidly, it makes it even more pressure, I think, to make sure that we're having this discussion and decision-making regionally.
Thank you. And I see that there have been a few questions pop up in the chat, and I want to make sure we have lots of time for a question and answer, but there's just one more question from the list for the two of you that I want to make sure we get in. So I'm going to go ahead and ask that now, and then we'll switch over to the Q&A. That is, we have elected officials, policymakers, service providers, HAC members, kind of a broad audience accessible to the two of you right now. What would you, from your perspective, ask of us moving forward? And I'll let whichever one of you has an ask in your pocket ready to go can go first.
I have like a long list, but mostly I want to say stay the course and do it faster. Right? Y'all are doing everything that we want to see done. You have adopted measures, you are getting things in line, you're massively hiring staff. You are really doing the things that we need to have happen. And I just want to say, keep doing it, keep pushing, keep fighting, and then also lobby to stop evictions immediately. That is the other big thing, because all of this will be for naught if the state legislature does not enact another eviction moratorium until we can get the rent assistance applications through. So those are my pitches.
Thank you. Andy.
I'd throw in there as well, and this is a theme that came up earlier, but listen to experts. I don't know anything about cars, but when my check engine light comes on, I go to a mechanic. I don't go to a neighborhood meeting and ask the first 8 people I talk to what they would do about the car. So I'd recommend not doing that for homelessness. And then and I should say the other part of that too is we all have to be brave in our conversations, so that and it gets tiring because I get it at cocktail parties too, but like when you get the feedback from community members saying things that we all know aren't true, we do have to educate people and not just say, thank you for your opinion, because we do need to get more knowledge out there about what the best practice tools are and what really is going to work. And then the last thing I would say, which is really boring, but land use and zoning. Like we have to, we don't have enough money, we're on the verge, hopefully we can get a big federal investment. I'm not sure which way that's going to go, but there's not enough money right now to solve the problem. So we have to be able to narrow the problem as much as we can. And we can do that with land use and zoning and having incentives in there that give advantages to people who are doing mixed income housing or affordable housing. Thank you.
Yes. Land use and zoning is incredibly not boring. So thank you for mentioning how important that piece is too. Okay, so I think Jacob has been monitoring the questions in the chat for us.
Yeah. He's monitoring them and sending them to me. I have big thanks for Jacob Rosales and Jacob Boyette here. So I've got one question from Narendra. Dr. Zapata, in addition to the item you touched on, increasing gap in affordability of home, what are some of the early signs before a person or family ends up on the street?
Yeah, so I answered this in the chat. It's structurally watching, like I think Andy's example was great. Like the check engine light equivalent for housing is watching rents go up and watching vacancies go down while rents are going up rapidly, right? And so we've had a massive spike in rents, and that is your first check engine light. The next one is to start looking at your middle, low, and extremely low income households and seeing what their rent gap is looking like. Is their rent or their rent burden? So that means the amount that they're paying over 30% for rent and household costs. So you want to make sure we know that every dollar over 30%, we start to see increases and people losing their housing. And so you want to be monitoring that as closely as possible as well. One of the things that's really tough right now is that our data are super unstable. So we're looking at the census polls data. We're going to have the decennial census numbers coming out continually. Y'all, those are tough numbers to really feel like we're getting a good, strong indicator of what is going to be really happening with people. And so I think really staying tied to our service providers, talking with your constituents to make sure you know if things are getting worse or harder is really important. I would say if you are, privileged, right? If you are comfortable economically, one of the things to keep in mind during COVID is that a lot of us who are already comfortable somehow got a little more comfortable financially. And that is just a reality. And so we are not the test to know that things have actually gotten much harder for people who are poor.
Thank you. And I see Ben has his hand up. Ben, do you want to ask your question?
Sure. This has been a great panel. I do have a question for Andy. I wanted to first relate to Dr. Zapata that Metro at one point, about almost 20 years ago, did try to get involved in making sure that this was a regional solution and that every community provided its housing, and they were sued by a lot of these cities. Some of us have been in the industry that long that remember when these cities were suing so that they didn't have to bring up their obligation. And so I think Metro has been really skittish at this point to take such an active role in monitoring where these jurisdictions are at. And those of us that advocate will continue to feel like this is something that we need inclusive communities across the region to really solve because the problem is so big. I appreciate you bringing that up. Andy, you guys are a moving to work agency in Vancouver, and I don't know how much you can relate to those of us here in Washington County going through the process to become a moving to work agency, but either through lessons learned or things that you guys are able to do that are pretty flexible and a little bit innovative being a moving to work agency. Can you give us some guidance on what we can do maybe differently in the future as we take on this new role?
Sure. Hi, Ben. So I think I would say a couple things onto when with the moving to work flexibility. One is that I think nationally, and one of the reasons why there's some controversy over the Move to Work program is that some housing authorities have used it primarily to do things that benefit the housing authority and not necessarily the people we're trying to serve. So I'm throwing that out there, but I think there are many ways to use moving to work flexibility in a way that's very positive in this conversation. And a couple of those, back to the conversation about sort of like low barrier housing and how to build it from a system perspective. Moving to work, you get flexibility to sort of blend different funding sources in the development process. So one thing that we do is, while there's not a lot of new public housing development happening for very good reason right now, we've been able to use some of those subsidies that we have banked by blending in move to work subsidy and making and creating supportive housing that way. We've used some moving to work flexibility in funding to actually pay for some of the service gaps that, if we couldn't figure out how to fill it otherwise. And one thing that we just started to do as we've, because obviously you don't get more money. So we have a structural deficit in our voucher program right now. So one of the things that we've done, because we can't necessarily afford to put a lot of new project-based vouchers into developments, even though it's very needed to get those deep subsidies, is we got from HUD permission to do a rent buy down, where we're just, so for the tenant, they're still paying 30% of their income, but we're buying the rent down from like the 30% AMI or 50% AMI level, not the full rent that you would normally in the PPD. So some immediate thoughts for it.
Thank you for that, Andy. I got distracted because I was like, what else? Let's see. I'm gonna call out this question. It looks like Dr. Zapata already answered it, but Chair Harrington asked, when has it been harder? When was homelessness harder within the last 50 years? I like the message of hope that it has been worse before so that we can get through this. Do you want to speak more to that?
So I put a link to a book as well, but the 1980s were awful. I barely have any memories of that time. And yet I know that they were awful, right? So in part because of the dramatic changes in federal policy. It wasn't like there was a slow rollback of federal dollars for housing. It was a massive rollback that started in the 1970s. There was a massive move on closing mental health care institutions for a lot of good reasons, right? They were terribly run, abusive environments, but the idea was that we would close those down and move to a community-based health model for mental health care support. And that second part didn't happen at all. We had the war on drugs. We had, then we started to think about framing people who needed government support as welfare queens, right? And that was a very racialized language. And so the speed at which these things happened, coupled with just the vitriol that went with it, was both the hardest time, but also where we saw the most dramatic increases. I will say, I don't think things have ever been worse for California than they are right now. But, in the sense that a lot of other places had to also deal with the rise in housing costs before we have. So, right, so all of these things in the 80s were happening as prices went up. And then of course the recession crashed everything. So it was really a confluence of a lot of terrible things in the 80s that I think that, yeah, I'm sorry, I got distracted by Ben's comment because I think I'm going to agree with it. He's in the chat. Yeah, so yeah, the 1980s.
Thank you. I think we're at 9:59. I think I'm gonna break us early. I know we had a lot of conversation happening in the chat. Paying attention to chat is like impossible to me because my brain is 100% at a time. So you guys keep doing chat. Call me out if I miss something. But I think we're gonna break just a little bit early. We figured out that in the first poll we had not checked the box that let panelists, which is the vast majority of you, participate. So we're gonna rerun that first poll and we'll do that. Let's do that now. Let's actually do that now. Jacob, can you rerun that first poll? And we'll see what the answers are now. And so this is, again, how well do you feel you currently understand the issue of homelessness in our community?
Wait, so are you going to make everyone feel like they don't know anything because you had experts talk? Or is this like a chance for people to like reevaluate? Like, I'm a little worried. I don't want to make people feel like they don't know the things they thought they knew.
No, this is just a chance for people to be honest with themselves. It's good, it's good. Let's see here. I also have like 4 computers open right now, so patience is so appreciated. Let's see, we've got about 73% participated. Let's give it another 10 seconds. This is also, I should point out, this is anonymous. I can't see how any of you answered. So if Comey wants to pop on here and say he has no idea about homelessness, no one will know, right? He would never do that. 80%.
Actually, that's what I did.
Oh, 5 seconds. Okay, go ahead and end that poll, Jacob, and then can you share the results with us? Okay, so yeah, we've got the vast majority of us feel like we have some at least basic knowledge or some solid background, which honestly I feel like is great because that lets us have a little more complicated conversations today, right? Like this is a good spot for all of us to be. So we are going to break. We will all come back at 10:15. And I'm going to remind you once again to go ahead and order lunch if you haven't already. But the Zoom webinar will stay up, but you all are welcome to turn your camera off for a little bit, go get more coffee, and we'll see you back at 10:15. Thank you very much. We are back. I need to fix my lighting. We are gonna run another poll. We're gonna take it a little bit later since we've been having heavy conversation. So this one is, if you had a time machine, where would you go?
I picked the future because I'm a very curious person. Hello, everyone.
Good morning,
Hello,
Commissioner.
Nafisa.
Let's see. We'll give it a couple more seconds. We've got about 70% have answered so far. Just give people a minute to get back on here.
I want to stay right here, right now, so I can make improvements now so that the future is better.
I love it, Chair Harrington. I love it. The curious in me just peeked out. I was like, I want to see what's ahead.
Well, I'm counting on you to make sure we do a good job now, so that when you get to that future, you can tell us if we did well enough or not.
Okay, let's see. Okay, we're at 76%. That seems like a good number. You want to close that, Jacob, and show us the results? So
We are split.
we are split. There's a good number of us who said I'm fine right here and now. I was one of those. Like, I'll work on the here and now. Everything else seems like more stress. But I like a lot back to my childhood so I can give myself some tips. I like that. That's great. So we are back, and I think we're ready for our next conversation. Catherine, are you ready?
Yeah.
Okay, great.
Oh,
Take it away.
all right. Thank you, Melissa. That was a great poll. Those are fun. Thanks for putting those together. And welcome back, everyone. Thanks for coming back. I'm hopeful that you're all well caffeinated and ready to jump into our next topic. Just as a couple reminders, we'll keep our microphones muted during the conversation. We'll hold this conversation in the same format. So we'll reserve some time at the end for Q&A. Go ahead and put your questions in the chat as you think of them and as we go. And again, Jacob and Melissa will lead us through those at the end. Yeah, that's it. So without further ado, I'm going to introduce our next group of panelists. We have 3 folks with us for our second conversation. Chris Boniff is the Executive Director of the Oregon chapter of the National Alliance on Mental Illness and oversees NAMI's statewide public policy and advocacy efforts. NAMI Oregon is a grassroots membership governed organization dedicated to improving the quality of life for individuals living with mental illness and their families and other loved ones through education, support, and advocacy. Chris has been active with NAMI for 15 years, starting with his work on NAMI Oregon's successful campaign to win mental health and addiction insurance parity in the Oregon legislature. And I have seen this amazing support that NAMI provides in people's lives, and so incredibly grateful for the work of NAMI. And thanks for being here this morning, Chris. Our next panelist is Katrina Holland. Katrina is a visionary and believes Oregon can be a place where all who live can exist and thrive. She serves as the executive director of Join, a homeless service agency dedicated to supporting community members to secure permanent housing and attain stability. Katrina has been involved with numerous housing and community initiatives in our community and is deeply engaged in volunteer efforts to make Oregon equitable for all. And I've seen the impact of Katrina's leadership, so thank you so much for being here this morning, Katrina. And Pat Rogers, our third panelist, has been working in homeless services in Washington County for 21 years. He's now the manager of housing and homeless services here at Community Action. Over the past 2 decades, Pat has been continuously involved in countywide efforts to understand the issues of poverty that lead to homelessness in Washington County. And it's been a great honor and privilege to be working with him for the last 20 years. And so thank you so much for being here this morning, Pat, and sharing your expertise with the group. So our first question is for all 3 panelists. In our first conversation with Dr. Zapata and Andy Silver, we talked about access to affordable housing as and stability supports as the most significant contributing factors that lead to housing instability and homelessness. In your experience, what do you feel are the top 1 or 2 contributing factors in our community? And I'll start with you, Katrina.
Good morning, everybody. Thank you for having me here. Happy to be a part of this discussion and appreciate the invitation. I think what Dr. Zapata and Andy stated this morning is absolutely true. A lack of access to affordable housing is a major driver. And what I mean by affordable housing isn't necessarily units that are designated as affordable, but literally the market that we experience has seen astronomical increases in rent that have been way outpaced wage growth for several decades. So houselessness is a phenomenon that has been in the making for a long time. It is not new. It is not, while it may feel particularly acute at this moment, what has changed is a visualization, not necessarily the number of folks experiencing it, although it continues to go up. I think the other contributing factors, and I think I heard some folks talking about that this morning, has to do with a lack of community and political will in addressing systemic failures that create the externality of houselessness. A perfect example right now, as I put in the chat earlier, there are close to 12,000 people who are at risk of eviction right now because of not being able to pay rent, most of which are driven by a lack of being able to pay rent because of COVID economic fallout. And when the legislature had an opportunity to discuss many different options that would have taken the burden off of tenants and paid for that back rent and therefore prevented homelessness, they chose not to do it. And so now we have 12,000 people who are at risk of eviction. A lot of them will become homeless, and another 27,000 folks whose applications have yet to be processed for rent assistance and may also miss their opportunity because the applications cannot be processed enough. I think it's really important to note that social service providers told the legislature, the state legislature, a long time ago, close to a year ago, that this system would not be able to handle its volume. As Dr. Zapata stated earlier, in the 1980s, there was significant disinvestment in our safety net systems. And that continued to perpetuate as years went on. And so a lot of us knew this is not the right course of action to take. We need systemic policy-based action that's going to prevent evictions. The legislature said no, and now we're looking at tens of thousands of people potentially hitting our streets. And that is not an exaggerated number, that is a quantified number put out by Oregon Housing and Community Services in the last hearing that they just had about the rent assistance. So that's a major contributing factor, political will.
Thank you, Katrina. Pat, you want to go next?
Well, I would definitely have to agree with the 2 panelists on almost every point they made during their presentations. I mean, it's almost like a collection of stuff that pops into my brain when I'm taking a shower over the years, you know, that I can never put it all together into a coherent statement or speech of any kind. But I've contemplated all of those things in the past. The thing I agree with the most is the idea that it's just a math problem for most households, and it has been. We've been collecting data, Community Action, for the same 20 years I've been doing this work, and all has indicated that the lack of affordability is one of the main contributing factors, and the lack of ability to attain a living wage for a large segment of the community puts people at risk throughout their tendencies. You know, one thing that goes sideways can create a chain of events that results in homelessness. And then the second thing I identify is that once that happens, the ability to return or correct your course, there are many barriers thrown up. So if you accrue any debt, you have the poor history now, that prevents your ability to access housing or return once you lost it. So then there are the traumatic things that also happen once you've lost your housing, which could be the loss of belongings, loss of paperwork, these sorts of things. The longer a person is without housing, the more likely they are to lose things that they need, items they need to make a successful presentation to a new landlord. So that's about what I have.
And Chris, same question to you.
Well, it's a little harder for me to answer that question in that what I can answer is through the lens of our population, which are people living with serious mental illness, people living with substance use disorders, people living with developmental disabilities, or some combination thereof. So I can't tell you why housing in general has done such a poor job, but I can tell you with our populations, it's because housing doesn't exist for us, period. So we don't fit anywhere. You know, we get kicked out of affordable, even if there is affordable housing, we get in it, we get kicked out of it. And by and large, this is because this is a set of healthcare conditions where healthcare and the people who pay for healthcare, they are allowed to abdicate their responsibility for outcomes that are healthcare related. There's historical reasons for that. I mean, the stigma associated with these disorders certainly is long, you know, that shadow casts far back into the past, in that we never thought these things were treatable. We never covered these things. So until Medicaid expansion, for example, we had a giant population of adults living with serious mental illness who had no insurance coverage. And even for people who have insurance coverage, whether that's Medicaid, Medicare, or commercial insurance, we don't pay for the treatments for the duration necessary to help people reach long-term recovery. And so you have this, you know, this huge number of people who don't succeed in housing and don't have access to housing, in part because of economic factors, right? Because of the disorders we have, where, you know, instability defines our lives. And so the combination of economics, the combination of not being able to gain employment, we're more likely to have interactions with law enforcement as a healthcare intervention for no other reason than, again, healthcare is allowed to abdicate. And then we become tougher to house because the longer you go untreated, the lower your baseline for recovery becomes. So the longer you go untreated with a serious mental illness, the more damage is done to your brain, meaning your recovery looks vastly different than had we done better when, for example, you had your first episode of psychosis. And I think it's that combination for our population. And then you layer affordability and access and all the issues that generally affect our population across the board that we're talking about. And it becomes, our population becomes that much harder to house. And in part also, I want to say this is, we don't build housing that is pertinent to our population. We have different needs. So Housing First is a great model. Housing First doesn't necessarily work for people with serious mental illness. It certainly doesn't work for someone with serious mental illness discharging from the state hospital who has just become stable after 180-day civil commitment. And so we think sequentially, we think linear, we don't do things concurrently, and we don't do things in variety. And that's sort of where we're at with our population. Until we sort of think in that manner, you can build all the affordable housing you want, and you should, you're still going to have a tough time with our folks.
Thank you for that. Okay, our second question is there's general agreement that a homelessness occurs when inadequate safety net services are available to address structural factors, gaps in affordable housing, jobs for lower jobs that pay wages adequate to afford housing at lower wage levels, income inequality, racism, lack of access to healthcare, mental health care support services, as you were mentioning, Chris, and those vulnerabilities contributing to inability to maintain housing stability. Can you share the work of your agency to address these factors? And I'll go ahead and start with you this time, Chris, if you don't mind.
Well, so let's talk about access to services. So while we're talking about all these great things going on, and in fact, we're coming off of a very historic legislative session where the legislature made some major policy bills, modernized the definition of parity, is pouring money into the system. Ironically, at the same time, our system is collapsing. So for all intents and purposes, our children's system is gone. If you are a family with a child with significant needs, there is no place we can serve you right now at all. The adult system has ground to a halt, so you can't go anywhere. And right now, you know, just to get outpatient services, you're usually in a 6 to 7 month wait just for that initial service. So what we're responding to right now is this immediate crisis, which is, you know, the legislature, again, has done these great things. You have things happening on the local level that could pay fruition in 2022, 2023, 2024. But if we wait till 2022 to do anything more, all we'll be doing is backfilling versus trying to build out. And so what we're doing right now, in fact, our frustration as NAMI has grown so great that we pulled together stakeholders from across the spectrum and said, how do we solve this issue right now? And, you know, I know I've heard there's some policymakers on here that regardless of what you do in housing, as it comes to our population, if we don't solve the workforce issue right now, if we don't infuse money into the workforce right now, there will be nothing to build out a year or 2 years or 3 years from now. And so that's the nature of the crisis we're in. And it feels rather ironic because we all came out of the session thinking, you know, bully for us, look what we just did. We have this historic achievements. And yet, as I said, during that same time, we've lost children's psychiatric beds. Two SUD providers providing services to youth have closed. We are losing adult beds because we can't staff them because, you know, Panda Express is hiring at $20 an hour and we're trying to pay people $16 to $17 an hour. So our agency, we have pivoted from thinking a couple of years out to thinking, you know, holy crap, if we don't do something right now, we're really all kind of screwed. And it's trying to light that fire of urgency under decision makers to understand if we don't build that bridge forward to things like the Metro bond, to, you know, new definition of parity, these new investments, we will all be bitterly disappointed at what we're going to be able to achieve a year or 2 or 3 from now.
Great, thank you, Chris. That's, yes, share your sense of urgency there. Thank you for saying that. Katrina, do you want to take it next?
Sure. So at Join, one of the things I can talk about a couple of different services that we're interested in expanding in this moment. Our mobile permanent supportive housing, which is essentially scattered site PSH. So market rate unit that is paid for with the voucher, some sort of a subsidy paired with mental health services, usually a private practitioner that's visiting somebody's home. A caseworker that is helping someone get through and get to their physical places to care for their physical health needs, as well as a caseworker who's working on the myriad of things that need to be addressed in order to attain sustained stability for somebody who's recently experienced houselessness. This is generally for our most acute folks, so folks that will unlikely have some sort of long-term income opportunity due to physical or mental or behavioral health barriers, and therefore is providing this level of services. But it can also include people who do have access to income as a result of after making several attempts to lower those barriers. I think what Chris stated is very true. Just as much as we are facing this issue in the mental health system, we're also facing it in the housing system. There is a shortage of workers. Hiring is really tough right now. And a lot of that has to do with how much we pay. You're asking for folks to experience vicarious trauma and supporting people who have experienced significant trauma in their lives, and do so with a level of expertise, compassion, and caring that maybe folks in the general public may not have. And yet we are saying that we can only afford to pay $18, $19, $20 an hour when the housing wage is closer to 24. So who would want to sign up to do that? Now, granted, there are a lot of folks who do, and they do amazing and great work. A lot of folks who just really care and you know, have the means to be able to make those sacrifices. And some folks who choose to do it because even though they are going to continue to maintain some level of relative instability in their own lives, because they are interested in doing that. But like Chris said, we do have to invest in the workforce now if we want to see those long-term payouts and rebuild the system in a way that is more sustainable. Some other services that we're looking at expanding include our in-reach team, which are folks that are going into shelters or places where folks are receiving transitional services and getting them on the path to long-term permanent housing opportunity, whether that is PSH, market rate housing, or other. Our outreach teams, what the Joint Office calls housing focused outreach teams. So folks that aren't just connecting you to services, but actually a caseworker who takes on the responsibility of saying, you're interested in the housing opportunity, meeting folks where they're at, building the relationship, going out and looking for apartments with them, paying down any barriers or debt loads that they might be facing and getting access to housing, working with the landlord as a liaison, helping to write reasonable accommodation letters if necessary, and then helping that person move into housing and sticking with them for up to several months, and then transitioning over to a retention worker who's sticking with that person for up to 2 years. So that's a little bit of the services that we've been talking about, and really excited to do that.
Pat, same question to you.
Well, at Community Action, we've always had an array of services such as utility assistance, employment support services, short to medium term rent assistance, utility assistance, things that are meant to help stop the bleeding. But one of the things that we're consistently doing throughout all the years that I've been working at the agency, it seems like the array of providers in a system have a tendency to want to fragment it constantly. And so we're always engaged in efforts through public forums or like the Housing and Supportive Services Network and those types of forums, just in an effort to bring people together and not and avoid the fragmentation that we have a tendency to have occur when you have multiple providers trying to address the same issue. So an example of that is in the sheltering network, where various shelters pop up throughout over the years. A lot of them do so independently. So we've been consistently engaged in making sure that we're all in the same room regularly and maintaining relationships with one another. And this is not only with shelter providers, but that's with the Department of Housing, the various mental health service providers in the county. Now we have an array of outreach providers. The challenge there is to avoid the fragmentation of the various providers that do outreach independently. So that seems to be the role of our agency in this community more than just the stopgap measures that and services that we always have in place in the form of short to medium term rent assistance and the stop the bleeding type things that we have always provided, is just to keep promote and advocate that we're all working together and all maintaining relationships with one another to the extent that we can maximize whatever we have at any given point in time for the benefit of and to improve the I don't know what word I'm looking for, but the efficiency, I guess, of whatever the system happens to look like at any given point in time.
Thank you for that, Pat. Thank all three of you. That's all three of these organizations are doing amazing work. It's great to hear about. Our next question is kind of related to how services have changed during the COVID pandemic. So how has COVID impacted how you provide service to the community? And I'll start with Katrina this time.
Thanks, Catherine. So for us, it did change a little bit, quite a bit. We had some staff that were immunocompromised or subject to severe COVID, so we made some adjustments in our day space to try to minimize contact and providing services outside. We didn't close it, obviously, but having our mail service, our gear, like coming up to pick up gear, coming up to pick up limited food options and other things like that, we are now doing sort of outside as much as we can through our side doors and our front doors. We also saw some decrease in being able to go into camps because of the nature of crowding. So folks are going at a regular interval of every, well, I'm sorry, we just resumed it. But for a while, before vaccinations were available, people were going once every 14 days. And then those that we made contact with or who are on our existing caseloads, and we had contact with who we're engaging with over the phone, providing phone, computer access for folks, and placing them into housing. We used to do like move-ins with folks where we're driving together in a car to go look at apartments, and then actually moving together with workers, actually going into, taking folks' stuff into their house. We had to stop that temporarily, although that is starting to pick up now as a result. Thank you, vaccinations. Retention services, we also did the same thing in providing phones and computers to folks to make sure that we don't lose contact. Yeah, those are some of the adjustments that we made during COVID, but a lot of that is starting to return to normal thanks to vaccination.
Thank you, Katrina. Pat, how has COVID changed the way you're providing services?
Well, the pandemic has changed things dramatically on a lot of different fronts. Just the change in the way that we interact with clients since the pandemic began is a big one. We found a way to work virtually with a lot of clients when we never would have even attempted that in the past. Meeting face-to-face with clients doesn't happen quite as often as it does, or homeless persons as it used to. But we found a way to make that work. In addition to that, just the amount of resources that have been made available since the pandemic began has been huge. And so we had capacity built around scarcity in the past. And then when the pandemic hit, all these dollars started flooding the system. And we were just a small little system based on a very small budget. And so we had to increase our a capacity in the form of hiring a lot of new folks to be able to get the funds out to people to help them prevent eviction or the potential for eviction, and then all the infrastructure type things that are connected to the frontline work also had to be built up. So getting the checks out to landlords in time and moving upstream and working with folks in eviction court to help prevent evictions in that environment. So just the amount of work has tripled or quadrupled, but that's good. And I think a little bit of skepticism I have around just this flood of money that came into the system. While that is great, it makes me wonder where all of that was in the first place pre-pandemic, because if it's possible now, it was possible then, and it was needed pre-pandemic just as much as it is now. So yeah, so basically just the volume of work and our focus on just the likelihood of these mass evictions is daunting, but also having the ability to do something about it has been different, I guess, for lack of a better way of putting it.
Thank you, Pat. And same to you, Chris. How has COVID impacted the way NAMI is providing services?
Yeah, so a couple of ways. So I'll talk about NAMI specifically. So at the state office, what we're known for is really working in policy circles, working with the legislature, working with large health systems. But the heart of what we do is through our 15 chapters is providing education classes, support groups, and workshops for just about any part of a family structure, community structure impacted by behavioral health disorders. And pre-pandemic, we did everything in person. Behavioral health, we were, really had a strong bias, as if nothing could ever replicate the in-person experience. We served about 14,000 Oregonians a year through our 15 chapters. With the pandemic, like everybody else, we were forced to go online, and we moved our classes online, we moved our workshops online, we moved our support groups online, and lo and behold, what we thought couldn't be replicated could. And not only that, one of the things in our world, we don't show up for a lot of stuff, right? We have an appointment, we don't show up. No shows is a huge issue, right? Because when I'm symptomatic, for example, I have a hard time getting to my appointment on time. If I have all these other stressors in life, in addition to childcare, in addition to symptoms, I have a hard time getting that appointment. We started showing up for appointments. Show rates went through the roof. People completed our education programs and workshops. So there was a real revelation to the benefit that technology could have, and a real discussion about, okay, where could technology apply and where could it not apply? Because it was very clear where technology couldn't apply. One, access was not universal, obviously. When you're working with children and families, virtual visits, that doesn't work, right? When you have a screaming 6-year-old running around, that's not going to work. So there really is, I think, some good promise around how we construct things moving forward. And it changed our view in terms of services. I think it changed the service delivery system as well. And so coming out of COVID, if we ever get out of COVID, where I think, and we're back to serving almost the same number of Oregonians as we served before. And yet we also are doing it in more remote areas where we didn't have chapters. So we are reaching Eastern Oregon. We are up and down the coast. So the one person in Coos Bay who's a parent raising a child who has something going on, wants to take our class NAMI Basics, they can do that from the comfort of their home. They can do it while they're feeding their child dinner. And so I think that's how it's changed services gives us opportunity. I want to temper that, though, with we will never get to that promise if we don't stop things. Everything is on fire right now in our system. And right, I really can't overstate that enough. You guys are going to go back to your policy circles. And what I'm telling you is the healthcare system for behavioral health has collapsed. So what's coming forward is unprecedented. And it's going to dilute whatever you do around housing. It's going to dilute whatever you do around outreach. It's going, it really, we are not preventing anything. And that means that the pipeline that has fed the population that we're talking about here, the spigot is wide open. And we have a critical juncture here in the next couple of months, maybe in the next 6 months, to take some action that could potentially have some impact on that. And it's a gamble because you don't know. We're in a labor market right now that we could start paying $20 to $25 an hour, and you still don't know if you're going to be able to compete for labor because we're asking people to come do labor, doing the hardest work that is absolutely possible in our healthcare system, working with the most acute kids and the most acute adults that you can in our healthcare system. But if we don't do something in the next few months, everything else may be for naught that we do, because we will never stop digging this hole and we will never get out of this hole. And so again, it may sound like I'm alarmist, but what I'm telling you is on the ground, people are not getting services, and the number of people not getting services is ballooning. And that is going to have a ripple impact in everything else that you guys as policymakers try to do in other areas of community life.
Thank you. Thank you for that. And I think that's a good segue to one of our questions. It's actually further down, but I think it's a good right now. What policy or practice would you, each of you, but we'll start with you, Chris, which policy or business practice would you prioritize for the Housing Authority of Washington County to implement?
Do more, do it faster, do it with variety. Partner with mental health. So we're mental health over in behavioral health. We're terrible at working with affordable housing, right? We all kind of work down our parallel tracks, and we still, after all these years of talking about it, still have not converged. But we have to, and we have to do it much faster. And we're going to have to make decisions that make neighbors upset because we have lost the luxury of time. And I think, you know, there's common wisdom, and I agree with this. COVID really has compressed time. So this, a good example, this legislative session that we have, this is absolutely historic. If this were 3 biennia ago, we would have a horizon of time to make difference. Metro bond, we would have the horizon of time to make difference. We have lost that luxury. It's gone. And again, this goes back to the crisis we're in now. If we don't do things sooner, faster, with variety, not sequential, not linear, but 3-dimensional, if we don't make some hard decisions that are clearly, you know, NIMBY in my world, just try citing something that's going to house somebody with a mental health disorder. You would think that you're bringing in, you know, Dracula and Frankenstein and every other associated monster to live next door to people. This all has to go faster. And I think it's, you know, if anything, again, to policymakers here, this is a chance where you really are going to have to show leadership, and you're going to have to catch fire. And God bless you if you do that, because that's why we elect you, to understand the gravity of the situation we're in and make bold decisions that are commensurate to the need that we're facing right now.
Thank you, Chris. Katrina.
Yeah, I just have to echo what Chris is saying regarding policymakers taking on a pretty strong stance. You know, I heard it earlier in the discussion at 9, you know, there's this, it's election season, and a lot of folks are attaching themselves to the crisis of homelessness conversation. And there's this newfound, I shouldn't say newfound energy amongst neighbors in talking about the frustrations of seeing so many people on the streets, and we got to do something now, and we can't continue to let people live in squalor. And that is absolutely true. And I would encourage policymakers to shy away from the temptation of trying to appease folks who are having these frustrations, and be prepared to catch fire for implementing the myriad of strategies that's going to address what we're facing right now. Like Chris said, you got to invest in the workforce when it comes to mental health, because the system is collapsing. We need that for permanent supportive housing. That is one of the most critical components, at least like speaking for Join, our mobile permanent supportive housing system. We have to make sure we are as Dr. Zapata mentioned earlier, investing in permanent housing opportunity and shying away from the temptation of investing all our money in temporary options and therefore looking like the East Coast, right? Because as much as we think that appealing to this call to action from some of these business leaders and other folks is going to quell their concerns, it's not, because the crisis of homelessness will not go away with those strategies. And we found that long ago when we first started talking about houselessness, right? I was just talking with someone on the phone, I can't remember who it was, who was describing Eric Sten's proposal on ending homelessness in 2004. He's saying some of the exact same things we were saying then, and we had a bunch of investments in shelters in the metro area, right? Since then, we've seen some increases. It has not fixed the problem. We will find ourselves in the same situation several years from now with neighbors who are even more mad because they've said, we need to get these folks off the streets and get them off the streets now and get our streets back. And then we try to build shelters, but we haven't controlled inflow and we didn't address the strategy over here and we didn't end somebody's homelessness over here. So they're back in the cycle of houselessness, right? And so we continue to see the uptick. We continue to see folks experiencing houselessness despite how much money we threw into shelter. So I would just encourage you to stay the course, invest in a myriad of strategies that's going to be required to help address the houseless crisis and shy away from temporary solutions. Catch the heat.
If I may just jump in with a little addition to that, and forgive me, but also I think people have to understand what is it that you guys as policymakers can influence and what is a responsibility of healthcare. So under the current construct, healthcare abdicates its responsibility. Nobody is responsible in our behavioral health system for doing what needs to be done from a healthcare response. And that complicates everything else we're talking about. And so rather than the Oregon way of everybody sitting around the table saying, we're going to work this out, entities need to hold each other responsible. And again, healthcare, both the delivery system and the payer system from commercial all the way through public, has always been able to abdicate its responsibility. So when you're talking about someone who's had long-term homelessness with serious mental illness, that serious mental illness, more likely than not, didn't have to be a long-term chronic condition. What it could have done if that person had access to first episode psychosis programs could have been stopped in its tracks when that person was young, and that person could have gone on to live a relatively normal life. Healthcare failed. And so we're paying the price around some of these conversations because healthcare is allowed to fail and is not held accountable for that.
Thank you, Chris. And thank you, Katrina. Pat, do you have any, what would you like to add to that? What policy or business practice would you prioritize?
It would be very difficult to add anything beyond what has already been said by Katrina and Chris. One thing I will say, regarding the Housing Authority of Washington County, over the last 5 or so years and continuing forward, I've seen a cultural shift in the way that they interact with the rest of the system and with people who are experiencing housing insecurity. I think they're on a trajectory to being more trauma informed with how they interact with folks that are experiencing housing insecurity and with folks that are experiencing behavioral health issues as part of their life. So beyond what's already been said, I wouldn't have anything really intelligent to say other than I have a lot of hope in what I'm seeing as far as a cultural shift in the practices of the Housing Authority of Washington County. And I would just encourage more of the same in that regard. You know, more of a trauma-informed approach in interacting with folks who they are serving with their services. So
that's great. I think that's been a pretty consistent theme. Things are on a good track. Do more of it. Do it faster because things are a little urgent at the moment. And that is a significant understatement. Thank you so much. We are very close to time, but I do want to make sure that we have you all have been so amazing and have had so much great insight to share. I just want to make sure that we have a time if there are any kind of burning questions, Melissa, in the chat.
I'm looking through chat right now, and it looks like for the most part, you guys are all over it, popping on and answering the questions as they come up. We were gonna break at 11 o'clock, so I would say if people want to break, you are welcome to. If you have a question and want to raise your hand and ask one of our panelists, you are welcome to do that. I know the way that Zoom works, only some people can raise their hand, so you can also still put stuff in chat, and we'll stay on top of this. Josh, go ahead.
Morning, everyone. I've had an opportunity to talk with Chris quite a bit since I moved here and engaged a lot with NAMI when I was working in Arizona. And one of the things that you've already hit on this. So you've already hit on this, Chris. So I might just be asking you to repeat, but one thing that I've really learned over the course of the last 3-4 years is about when somebody is experiencing behavioral health challenges, how that path of decompensating multiple times, how that just kind of leads to the situation just becoming so much tougher for us to be able to house and successfully provide services. And I was wondering if you might just be able to talk to that a little bit more, because someone came up to me just a week ago and said, I saw somebody walking down the street, they only had one shoe on and they're screaming at the top of their lungs. Like, why don't you get them in a house? And you know, it felt like such a vast oversimplification of what that human being has experienced and what they've gone through. So whenever I hear you talk about just like how, you know, decompensating multiple times and what that does to an individual, it's always been very reflective and helpful for me.
Yeah, well, you know, again, when you see someone on the street who has serious mental illness, that typically is the end of a long chain of failure, right? I mean, that person didn't start there. They had psychosis, the first episode somewhere. And then we didn't intervene, or maybe we did, and it was really, you know, half-baked, and then they were allowed to do it again. And I think to your point, Josh, people need to understand the longer we go untreated, particularly as we're talking about things that involve psychosis, the more damage it does to our brain, the lower our baseline for recovery becomes. Now, I don't want to say that is without hope, right? So you can go 20 or 30 years and have a lower baseline for recovery. But if you have access to a series of treatments called cognitive remediation, we actually can bring a good share of your cognitive function back. But you can't find that in Oregon. We don't have it. We don't have the mobile crisis team that can work with a person walking down the street with one shoe to do the hard work, which is now taking a case that is really, really hard and getting that person to some place where we can start introducing stability, right? We have none of these other features in the system, but I'm also always reminded that that person who becomes sort of dominates our conversation is, what are we going to do with the hardest cases? Didn't have to be the hardest case in the first place. And that's why I you know, from NAMI's perspective, we always think sequentially when it comes to public investment. First, we're going to do this, and then we're going to do that. And 2 years from now, in the next biennium, we're going to do this. And we can't do that anymore. If you don't do things concurrently, if you don't put the massive investment that it's going to take, Josh, to serve the person you're describing, at the same time, put in the investment and hold payers accountable for getting a person like that access to first episode psychosis programs, because that person probably had onset at somewhere between 16 years of age and 22 years of age. If we don't do all these things simultaneously, we won't get out of this hole. And hopefully that kind of addresses the themes, Josh, you are. But I do want to underscore, that person who's walking down the street with one shoe on screaming, that person got there after years, if not decades of failure. Didn't have to be there in the first place.
Absolutely. And I think, you know, there's a question in here, I believe from Narendra, that says, being empathetic to all sources of homelessness, what priority would you assign to getting folks who are living in tents or on our streets into shelter? Does that not help the condition of mental illness getting worse? Answer is yes. That's been our experience, right? For folks, and I think Chris has been speaking to this very, very eloquently in saying there's a specific type of support that's needed for folks who are experiencing mental health crises. And oftentimes shelter and even alternative shelter is not that place. It ends up making the conditions worse. Residents end up getting into conflicts with folks. At Join, we ran an alternative shelter called C3PO during the beginning of COVID, which was a social distanced sanctioned camp area in 3 different areas in the city. It was most often that our folks who are experiencing mental health crises that were getting pushed out of the camp and back onto the streets. It is not a good option for them. For some, it might be, but for the vast majority of our experience, that's not been the case.
Thank you so much, both of you. Okay, are there any other, oh, Mike, you have your hand up.
Hey, yeah, thanks so much, everyone. So kind of digging in more to this discussion around folks living with serious mental illness and like, where do we see, you know, interventions that are really working? Chris, I want to loop back to one thing you said that actually surprised me a little bit, was around, you mentioned that housing first doesn't work for people with serious mental illness. And I wonder if you could dig into that a little bit more for me, given that like the original model for housing first was really designed around people with serious mental illness. Like, can you tell us more about that that comment and kind of what you see as really helpful?
I don't want to say housing first doesn't work as a blanket statement, but I think Katrina just hit on it. If that's your only model, then you'll fail. Because, you know, again, shelters are a good example. Well, here, I'll use an example. So Unity here in the Portland metropolitan area, and frankly, Unity, we build Unity and all our problems are going to be solved. Well, you know, for those of us who would never go into an open, if I ever had symptom, and I've told my family this, if I'm ever symptomatic, don't take me to Unity, right? I can't sit out in the open. I can't visit with my family, right? I mean, there are just certain factors where it's just not going to work for me. So housing first again, I don't want to belittle the model. It's an effective model. It's a good model, but it's also bumpy. It's disruptive. It's, you know, if I'm stepping out of the state hospital and we've just spent all this money to stabilize me, putting me into a bumpy environment where there's a lot of disruption and where you have a really complex and difficult population, I'm going to get worse. And so it's thinking about the variety that you need available given the need that's presenting itself. And so, you know, again, that's a blanket statement. Housing first doesn't work for serious mental illness. Yeah, it was developed for that, but there's also pretty good evidence that, you know what, it doesn't meet our needs. There's going to be a portion of the population that's not going to meet their needs. And I think that just goes back to kind of Katrina's comment that, you know, there are those of us who aren't going to do well in a shelter. And if all you do is build shelters, you're not going to do away with the problem. If all you do is housing first, you're still not going to address the problem.
Sounds like it would be fair to say it's not so much that housing first doesn't work, it's that housing only doesn't work.
You have to have variety, and that's where public policy is always sequential. First this, then this, then this. And in maybe slower times that would have worked, but we have to think 3-dimensionally, and that's not something we do naturally, even outside of public systems, right? But that's where we're at. If you don't do the variety, you just are not going to be able to stop digging the hole we're digging, and we're just at that point. And again, whatever time we had before, that's gone. We no longer have that luxury. And so it's, yeah. So. Yeah.
And if I can add to that really, if I can add to that point, Chris, Mike, I think I think a perfect way to describe it would be, when I first got to Join, I heard of a situation where one of the caseworkers had a client who was experiencing psychosis. The landlord called this caseworker and said, the person that you're dealing with is having a psychosis episode. I'm going to issue them a 24-hour eviction notice. They have to be gone tomorrow. The caseworker ended up going to the apartment complex. They helped calm that person down. I think we got them connected to to some immediate care right away. And we negotiated with the landlord some different stipulations that are rules or something that we could put in place as a temporary measure to hold that unit for that person. So that when they came back, they wouldn't get worse because now they don't have a place to live anymore. Treatment housing, treatment options, and housing first as a model complement each other to maximize success for the person. So for somebody who's experiencing mobile permanent supportive, or who's going through mobile permanent supportive housing services at Join, we have a mobile private counselor who goes to people's houses on a regular basis, right? Depending on what the person may need, it might be every 2 weeks, it might be every week. For some, it might be every month. But that mental health provider is able to make a call that this person is stable, this person is not. When that person is not stable, that mental health worker has to, just a minute, sweetheart, that mental health worker has to have a place that they can send that person for services if necessary, if it's going to threaten their housing stability. So it isn't necessarily that Housing First doesn't work for folks, it's that Housing First needs mental health care and physical health care and all of the other things in order to maximize success for that person. So they're not separate, they're in a way one and the same. It's all toward the same journey.
That is amazing. And I am so hesitant. I hate to end such a rich discussion, but we have promised people a break and we have another panel coming up. So thank you all so much for the amazing questions and the rich discussion. This has been phenomenal. And thank you again to our panelists for being so generous with your time and expertise this morning.
Yeah, and wait, I would say thank you to Katherine for moderating both of these conversations. Big thank you, Katherine.
Thank you, Katherine.
Great.
Thank you. So maybe if you guys don't mind taking a slightly shorter break so we can get closer back to on schedule, could we do like a 5-minute instead of a 10-minute? Is that okay? Wonderful. Thank you so much. So we'll be back like 11:16 and we'll go from there. Okay. Thank you, Melissa.
Okay, we are at 11:16. And I just wanted to say the chat is still really busy. I totally encourage people to keep an eye on that and keep participating. That's great. That's what this is all about. As we get people back in, we'll do our third poll question. It's a tough one. How many cups of coffee have you had so far today? So go ahead and answer that as people join us again. This is great, sort of gives me an idea of who's back on.
Hi, Cadence.
Good morning. It's nice to see you all.
Likewise.
Okay, I'm going to give it another 10 seconds. Creeping.
Hi, Chris.
Good morning, Comey.
Okay, go ahead and close that, Jacob. Let's see what we see. 2 cups. 2 cups is the winner. But I do see that some of you are creeping up there. So hopefully you're not too jittery. Feel free to stand up, stretch if you need to. Next, we are talking about the housing development pipeline in Washington County, sort of all the things that are coming on board. And I am just going to throw it straight over to you, Chris. Go ahead. And I've got the PowerPoint here. So if you just tell me when to advance slides, I will go ahead and do that for you.
Melissa, I think I'm going to start us off. Sorry, Chris.
Okay, thanks, Shannon.
Great. Well, good morning, everyone. Thanks for this opportunity to be with you this morning. I'm joined by my colleagues, Chris Hardy, Senior Project Manager at the City of Hillsboro, and Cadence Petros, Development Division Manager at the City of Beaverton. And I'm Shannon Wilson, Housing Development Manager at the Housing Authority. And we are here this morning to share with you the housing development pipeline within the county. And really the bulk of the presentation is focused on the implementation of the Metro Affordable Housing Bond within the county. Next slide, please. So first, I just briefly wanted to provide some context for the Affordable Housing Bond. I think a lot of you are familiar, but just to ensure that we are. The Metro Affordable Housing Bond was approved by voters in November of 2018. This is a regional effort, so including the Tri-County area, the Washington, Multnomah, and Clackamas counties. Brings a total of $652.8 million in capital funds to support the production of 3,900 units within that Tri-County area. So it was approved by voters in the end of 2018, and then took about a year for us to develop local implementation strategies, negotiate intergovernmental agreements, and those were approved at the end of 2019. There you can see on the screen the total, just over $188 million in capital funds, and that is the allocation to Washington County overall. And so that includes the cities of Beaverton and Hillsboro, which each received their own allocation of affordable housing bond funds to administer, and then Washington County's implementation area. And so Washington County's implementation of the area of the bond is the area of the county that is outside of the cities of Beaverton and Hillsboro and within Metro Service District. So it does exclude some portions of Western Washington County, particularly the cities of Banks and North Plains. And so overall, though, within the county, including Beaverton and Hillsboro, with that allocation of $188 million, or just over, in resources, the overall unit production goal with those funds is to produce just over 1,300 units. You can see there on the screen, 1,316 units exactly. So next slide, please. So this slide has a lot of information on it. Really the intent of it is to demonstrate the overall pipeline of projects that, that Chris, Cadence, and I are going to walk through with you today. On this chart, you can see the allocation by, or see the pipeline by jurisdiction there. And the thing I want to draw your attention to, which hopefully you can see it on your slide, I can't see it on on mine is the orange square at the bottom, which has a total number of units. And so that number, which hopefully you can see, is 1,475 units, I believe, just under 1,500 units total. So what I wanted to highlight about this slide is that overall within the county, in terms of our overall unit production goal for the Metro Affordable Housing Bond, with our current pipeline, we are exceeding that overall goal. There are some nuances to that and other goals that underpin that larger unit production goal, goals around the number of family size units we produce, or goals around the number of extremely low income units that are targeted to extremely low income households. But in general, we have exceeded that overall unit production goal target. So as a part of that, I wanted to highlight also that so the number of units is a great benefit to all of the households who will live in those units. And in addition to that, these projects really bring a significant amount of economic investment to the county. So just as a rough estimate, very rough estimate of the total development cost of these projects, it exceeds $500 million. And so that's $500 million of investment coming to the county. And the construction that occurs at all of these sites, it creates hundreds of living wage jobs during that construction process. So I wanted to highlight the benefit, not just to the households who will move in and the affordable housing it provides, which we're all here this morning because we care a lot about affordable housing, but also to the economic investment it makes to the county overall. And so with that, I want to hand it over to Chris Hardy from the City of Hillsboro to talk about their pipeline.
Thanks, Shannon. Okay, thanks everyone. Can you hear me okay? Okay. Happy to be here today to talk about affordable housing development in Hillsboro. And am I able to advance the slides, or will somebody be doing that? There we go. And go ahead with the next slide. Okay, the city currently has 3 projects in the affordable housing development pipeline. 2 are affordable home ownership projects in partnership with Habitat for Humanity and Proud Ground. Alder Commons and Century Commons will provide permanent affordability through the Community Land Trust model and deliver 26 new homes to low-income homeowners in Hillsboro. I know the focus today is on Metro Bond, but I included these projects to show that projects are happening without the use of bond funds. These will leverage state LIFT funds, CDBG, and other sources. And because affordable home ownership is also a priority for our city council, we found through our engagement that low-income community members don't want to be renters forever. They too want to realize the dream and value of home ownership. And this is especially true for communities of color who have historically been left out of home ownership opportunities. Our first multifamily rental project that will include bond funds is Nueva Esperanza, meaning New Hope. It's 150 units, and that's with partners Vienna Star and Housing Development Center. And I'll cover this project in more detail today. I think it's also significant to mention that Hillsboro will be donating almost 10 acres of city-owned land for these projects. Credit to our city council who have prioritized affordable housing to the extent that we are repurposing city land originally intended for parks and other uses for housing now. Next slide. For Nueva Esperanza, we are donating a 6-acre site on 53rd Avenue, right across from the city's new community center. And through a competitive RFP process, we selected Vienna Star in a co-development partnership with HDC. There you see the development team, and I want to give a shout out to Scott Edwards Architecture. They've truly done an amazing job on this project. Over 70% of the units will be family sized with dozens of 2, 3, and even some 4-bedroom units, which are much needed in Hillsboro for families. 60 units will be deeply affordable, which is 40% of the project. Vienna Star will be providing resident services along with the partners listed there and others. There is a 20% diversity contracting goal based on total project costs, which the development team has fully embraced. And groundbreaking is coming up in January, and we're anticipating completion and lease up in summer of 2023, just a couple of years. Next slide, please. So Vienna Star, working with Scott Edwards and LMC, has done a really great job with community engagement, informing the design of the project. And they have also been really proactive with engaging diverse contractors. So these are pictures from a recent event at the site, partnering with trade association Latino Built. And attendance, as you see, was great. And these Latinx contractors learned about the project and were encouraged to bid on the construction bid package being released this week. Next slide. So Nueva Esperanza incorporates a lot of culturally specific amenities like outdoor places and plazas to hang piñatas, boot washing stations for ag workers, sliding doors to separate cooking from living areas for Somali community members. It also includes packaged thermal heat pumps in each unit for heating and cooling, as well as ceiling fans in each bedroom and optional AC ports in some of the harder to cool bedrooms. Many more project amenities we could cover, but in the interest of time, just wanted to highlight a few. Next slide, please. The city's bond allocation you see there at the top is 40.6 million, relatively small compared to the county's 116 million allocation, but it's a real game changer for the city in supporting affordable housing. And here are our associated production targets. So 284 units total, 117 deeply affordable, and 142 family size units. With the Nueva project, we've allocated 42% of our bond proceeds, but at the 149 affordable units in the project, it delivers over half of our production targets, over half of our 30% AMI targets, and 74% of our family size unit targets. So we're well positioned to exceed our production targets under the bond program, just as the county and Beaverton are doing. We have more work to do to deploy the remaining 23 million. We have some plans that I'll share here for our next development. Next slide. So next up for Hillsboro is to bring another publicly owned site forward for disposition and development of affordable housing. We are working closely with Metro staff on a property acquisition in Hillsboro, and Metro just put in an offer on 2 adjacent sites. If we close on these properties, we would then do a joint solicitation with Metro to select our next developer and project. And based on the acreage, we estimate that this will deliver another 50 to 60 new affordable housing units toward our goals. So that concludes my quick presentation. I want to say thanks to our mayor and council, and I want to give a special thanks to my colleagues at the county and Beaverton. We really appreciate the strong partnerships that we've established, and I think those partnerships are really prominent here in Washington County, especially on affordable housing. So thank you.
Great, thank you, Chris. And up next is Cadence from the city of Beaverton to talk about their efforts.
All right, thanks, Shannon. We can just rest here for a minute. So I want to start today by doing a couple of shout outs and thank yous. And so I'll start by echoing what Chris just said. I think that in Washington County, we should really congratulate ourselves on truly effective partnership, multi-jurisdictional partnership. I feel like the last several years, Hillsboro, Beaverton, and the county have built a solid foundation for then what happened to us, right? Then COVID happened. And had we not built that relationship beforehand, our coordination during COVID would have been more fractured. And so I guess what I want to emphasize is not only are we totally rocking it on the Metro Affordable Housing Bond implementation, which is what's happening, but it has these ripple effects for our ability to serve our communities cohesively, to coordinate with culturally specific organizations, community-based organizations with less friction and more efficiency, and overall build a more seamless network for service and housing delivery. And I think that what started as, oh my gosh, how are we gonna do this, has really blossomed into a new way of doing business that I think is gonna serve all of us and is really a much more fun way of doing things as well. So I wanna start with that. And then normally today you wouldn't have me, you would have Javier Mena, our Senior Affordable Housing Manager, do this presentation. He is, I think, finalizing his trek to Machu Picchu right now, so is unable to attend. And I'm super, super jealous of where he's at. You guys are great, but like sunrise at Machu Picchu, I think would probably top this. I want to give a shout out to Javier, because while I was involved in the front end of the bond effort, he has strategically implemented this effort for the city of Beaverton, and has done a phenomenal job making sure that these funds are spent and with equity in mind, efficiently and quickly, so that we can actually deliver the units, and with our long-term partnerships in mind as well. So with that, I guess I'll start giving you the details you came here for. Next slide, please. So the city of Beaverton is committed to provide 218 units. Spoiler alert, we're on track to surpass that amount. As Shannon intimated earlier, we have requirements for family-sized units and very affordable units, and we are on track for that as well. Next slide, please. The Marianne is open and leased up almost. And so I guess that was my final shout out that I forgot, which is to Reach. And Alma's here today, and Ben worked on this one as well. So a really double shout out regarding the Marianne. We're so excited that this project adjacent to Beaverton High School is complete. It's gorgeous, 54 units. We had great COVID participation, and we're going to have resident services by Bienestar. And what I want to say about this project, the Marianne is named after Beaverton's first teacher. It is not only going to provide an anchoring place for families who are low income, but it's also going to serve the community as a beautiful location with amenities, and will really serve to bolster the entire neighborhood. And we're really excited about this addition to our downtown, because, right, not only because it makes the downtown look more beautiful, but it helps dispel the myth that affordable housing is a problem for a neighborhood, when in actual fact, this is something that's going to be a stabilizing influence in our downtown. Next slide, please. Our next project in the pipeline is the Wish Camper project in South Cooper Mountain. This will be a 309 unit project with 80 senior units. We are marching towards groundbreaking, and they are proving to be a fantastic partner for us. This is also a location that will be home to the only commercial activity in South Cooper Mountain. Our new expansion area is very close to Mountainside High School, and so essentially what this will be is a whole anchor to a new neighborhood, and that it's near River Terrace. It's also proximate to South Hillsboro. And so when we started doing the South Cooper Mountain area planning, we knew we wanted affordable housing, right? You always want, we wanted affordable housing in Bethany too, right? And so sometimes what you want isn't what actually happens. And so this development and the bridge project that Shannon will be talking about later really not only say we're dipping our toe in affordable housing in these expansion areas, but we're really doing it. We're really going to have affordable housing in these urban growth boundary expansion areas where it's been so difficult to make happen for all the reasons: higher SDCs, fewer services, all the things that become barriers to affordable housing. This is a big win for Beaverton and for the community. And I'm hoping that as we consider other urban growth boundary expansion areas, we really consider what are the resources necessary to ensure that affordable housing is located in those areas as well. Because one of Beaverton's most fundamental policy objectives with regard to housing is that we have a mix of housing types for a mix of incomes throughout the entire city. And without regional effort on that, it's not going to happen. All right, next slide, please. And El Monica. So this is a partnership with Metro, a Metro-owned parcel adjacent to the El Monica Transit Station. Reach is the developer of the affordable housing project after a competitive solicitation. And again, this goes to Beaverton's policy objective to ensure that there is affordable housing all around the city. And whereas in the first, the last project I talked about in South Cooper Mountain, where the access to public transit is a much hoped for, hopefully soon to be realized future, this project is directly adjacent to light rail. And so the residents here will benefit from that amenity from day one. And we are very excited for this project to break ground as soon as it is able to. Next slide. And then our fourth and final affordable housing project, we are working towards a development solicitation for our most deeply affordable project that we are calling a senior housing project. We have a tentative site. We have some hurdles to work through, but we're in the planning process for that now. And fingers crossed, we'll be getting the go-ahead to move forward with that in the next several months. And then we'll be done. And what I mean by done is we'll be broke. And so we've built this infrastructure at the city. We've whetted our appetites. We've been talking to other developer partners. We've been building relationships with Latino Built and other co-bid partners who can help us ensure that the workforce and the contracting is made available to equitably. And the Metro bond dollars are fundamentally critical to being able to continue to develop the housing that we know our region needs. And so we'll be turning our eye to LIFT and to other forms of funding. But I've been saying maybe for too long, but we really need to be thinking about what's the next bond. How are we going to keep this flow happening? Because while we should be congratulating ourselves on how we're building new affordable housing units, how we're going to very likely exceed all of our projections for units delivered, it's not enough. It's not even close to being enough. And so as an advisory committee, as elected officials, as staff who work in this area, we really need to be putting our minds together to figure out what are we going to do next and when. Thank you.
Great, thank you both, Chris and Cadence. Have the next slide, please. So I want to provide this map because geographic dispersal is an important consideration as we look at funding projects throughout the county. And so on this map, it includes the 10 projects that are in the county's pipeline in our implementation area, within the county. It includes 2 of the 4 projects Cadence just spoke of in the city of Beaverton. They're in the maroon color, and then Hillsboro's Metro Bond Project Nueva Esperanza there in green. So the map just, is a great way to see that dispersal of projects, of funded projects throughout the county. Next slide, please. So since we have a portfolio of 10 projects to date, I'm going to run through them pretty quickly, but I do have 3 that I wanted to focus on. So the first 7 I'll kind of run through relatively quickly, and then focus on the 3 at the end. So the first one is the Aloha Housing Project. It's at the intersection of 175th and TV Highway in unincorporated Washington County. 82 units, and Bridge Housing is the sponsor. Next slide, please. Goldcrest Apartments. Those are the apartments that Cadence just mentioned. It's in the South Cooper Mountain area, just on the other side of Mountainside High School. And that project is also sponsored by Bridge Housing. Next slide. Tigard Senior Housing is 58 units, and it is located right immediately adjacent to the Tigard Senior Center on donated land from the city of Tigard. And that project is sponsored by Northwest Housing Alternatives. And next slide. Salzman Road Senior Housing is 53 units located in the Cedar Mill area of unincorporated Washington County at the intersection of Dogwood and Salzman. And it is sponsored by Home First Development and Christ United Methodist Church. Next slide, please. Planbeck Gardens is 116 units in the city of Tualatin. Excuse me, it's just north of Tualatin High School on Boones Ferry Road. And it is sponsored by Community Partners for Affordable Housing. Next slide. Las Los Amigos is 113 units. It's in the city of Cornelius, just kind of kitty corner from the Fred Meyer in Cornelius. And it is a partnership between Reach CDC and Bienestar. Next slide, please. And the Valfried Avenida 26 is 36 units located in Forest Grove at the intersection of 26th Avenue and Main Street. And this project recently began construction this summer, and we had the opportunity to have not a full groundbreaking ceremony due to COVID, but a groundbreaking photo op, at least, with the golden shovels and hard hats and all of the VIPs. So those are the first 7 projects. The next 3 I wanted to highlight in a little more detail for a variety of reasons. So next slide, please. Yeah, so the Valfrey is named after our former director, Val Valfrey. So it's not Cadence's note in the chat. So this first project I wanted to spotlight is the Viewfinder. And this project is located in the Tiger Triangle area at the intersection of 72nd and Baylor. CDP, Community Development Partners, is the sponsor of this project. And this is the county's first Metro Bond project. It was a phase 1 project that was allowed to kind of be approved before we had the intergovernmental agreement in place. And so a couple things I wanted to highlight about this project. The first one is the lease-up process. So since it's our first Metro Bond project, it's the first one where we're directly involved in that lease-up process. Excuse me. And we've been very intentional about engaging with culturally specific organizations, both in the engagement to inform the project design, but also in this lease-up process too. And so that's been a new way for us to think about how we can support not just a Viewfinder, but all of the other Metro Bond projects in their lease-up process. So looking at screening criteria and ensuring that, is it the appropriate level of screening, does it screen people in rather than screen people out? And then looking at whether the outreach and marketing is really reaching the different cultural populations that we're trying to reach. So that's one thing we've really worked hard on at this project, and particularly our AmeriCorps Vista member who's been dedicated to that work specific for this project. The second aspect I wanted to highlight about this project is the alignment with the Supportive Housing Services measure. So this project, it began construction in 2020, and that was before the Supportive Housing Services measure was really in place or even approved, I believe. So as we've gotten the supportive housing services measure underway beginning this summer with Jess Larson and her team on in our department, CDP and that supportive housing services team, they really got to work right away, and along with the service provider there, which is the Good Neighbors Center, and look for ways that we could align with this existing or kind of almost existing Metro Bond project with the supportive housing services measure to provide some permanent supportive housing at this project. So it was not envisioned at the beginning when the project first went through the steps of approval with Metro, but now we have been able to put in place an agreement to provide some permanent supportive housing units here and align the Metro Bond and supportive housing services measure here. I also want to highlight the project has 8 units that are also set aside for veterans with VASH project-based vouchers. And then if you can click, it won't advance the slide, but there's one more image on the slide. So the last thing I wanted to highlight about this project is the art that will be featured around the project or within the project. And so this is one example of that. It's a mural that will be featured at the pedestrian entrance to the building. And so 3 local artists have provided artwork that will be used throughout the building. And as you can see in this mural, really the intention with the art is to feature some of the local buildings from Tigard, you can see there's some old clip from an old Tigard newspaper. The buildings in there are taken from Tigard historic photos. And also the people who are featured in that mural are actually were clients of the Good Neighbor Center who were photographed by the artist and then included in the collage. And so the intention of the art is to really help residents feel welcome, not only at Viewfinder, but in the Tigard community as well. Next slide, please. The next project that I wanted to spotlight is the Aloha Inn. So this project is envisioned to be the county's first all permanent supportive housing project. So it's a motel. It's at the intersection of 198th and TB Highway in unincorporated Washington County. And it was a motel. It had 52 rooms and then some additional kind of storage space. And we are looking to convert that into 54 units, essentially studio units, have kind of a kitchenette, not a full kitchen, but able to be 54 permanent supportive housing units. And with this project, I really wanted to highlight the role of our assistant director, Josh Kreitz, in the project. He's really championed it from the beginning. We first went in early 2020 with a leadership of Health and Human Services Department and toured the motel, and that was before the supportive housing services measure. And there wasn't a clear path forward in terms of services that may be available. But Josh from the beginning had the vision of this being an all PSH project and has really championed that through. And so just really wanted to acknowledge his leadership and vision on this project. So it's also currently being used as a shelter. Half of the building is being used as a shelter, providing 22 beds. And then the renovation work to convert it will begin this December. And the units will be available as permanent supportive housing units later in the spring of 2022. So next slide, please. And the third project I wanted to spotlight, so the 10th one overall in our portfolio to date, is Terrace Glen Apartments. This is 144 units. It's located in Tigard, just across the street from the Washington Square Mall on Greenberg Road. And I wanted to feature this project. Related Northwest is the sponsor of the project. And this is the largest project in the county in our implementation area in our portfolio. So I wanted to feature it for that reason. And it is also the only one that has 4-bedroom units. So I understand Hillsboro's Nueva Esperanza project has 4 bedrooms, and this project also will have a handful of units that size. And we understand there's a need for large family size units, but it can be very challenging to finance into a project and to really make that work. And so wanted to call that out about this project. And then the final reason I want to spotlight it is it is the next one that will begin construction. Our development team is working furiously on getting to closing for the project, and so it will close next month and begin construction next month as well. So next slide, please. And so that gave you a sense of the pipeline of the Metro Bond projects in the county, and then the City of Hillsboro's 2 additional home ownership projects. And so I just wanted to kind of wrap up with these 4 larger themes that we've seen with implementation of the Affordable Housing Bond. So the first one is that the housing bond has really leveraged a funding source at the state that was previously underutilized, and that is the 4% low-income housing tax credit. So there are 2 kinds of tax credits administered by the state. I don't want to get too much into the detail. There's a 9% and the 4%. But the 4% did not provided less equity than the 9%. And so it was more challenging for developers to use. And so the housing bond has really provided that additional subsidy that allowed it to be well paired with the 4% tax credit. And so nearly all of the projects that we've talked about today utilize that 4%, that combination of affordable housing bond and the 4% tax credit. The second trend I wanted to highlight is that the affordable housing bond has attracted national and multi-state affordable housing developers to the county. So the Wish Camper project in Beaverton and Related Northwest at Terrace Glen. And so by attracting these larger developers, I mean, this work is complex and technical, and we're lucky to have a strong group of talented, experienced affordable housing developers already in the county. And so the addition of these other developers really just add to that capacity of being able to get units going and underway, and really supplement the great work that had already been occurring with our developers. The third trend I wanted to highlight is that in addition to bringing those larger developers or national multi-state developers, is that the housing bond is also bolstering community-based nonprofit developers in the county. So in the county, the two developers really rooted in the communities in Washington County are Bienestar and SEPA, Community Partners for Affordable Housing, where the bulk of their portfolios are both within the county. And for both of those organizations, the projects that they have that have been awarded Metro Bond funds are the largest in their portfolios for their organization. So at Bienestar, it's the Hillsboro Nueva Esperanza project, and then in Cornelius, the Plaza Los Amigos project. Both of those are well over 100 units. And the same with SEPA with its 116 unit project in Tualatin. And so these community-based groups are really essential to the county. I mean, they're the ones that can connect very well with community members, both as volunteers and as donors, and are able to really engage with their residents as well in terms of providing resident services and connections with other community groups. And finally, the fourth theme with the implementation of the Affordable Housing Bond is an increased focus, or more operationalized focus maybe, on advancing racial equity. So looking at that through community engagement around informing the actual design of the projects themselves. It's looking at diversity in contracting when the buildings are under construction. And then again, focusing on that community engagement during the lease-up process. And then the dual focus also of providing units to extremely low-income households. It was quite challenging prior to the Metro Bond. We didn't see a lot of units developed that served households at 30% median family income and below. And the Metro Affordable Housing Bond required it. And at the time, it seemed quite challenging and concerned about whether we would get there or not. And in implementation of the bond, we've seen that it is possible to provide more 30% units. And so those are some of the themes that we've seen thus far in implementing the bond. And I just really want to conclude this presentation by stressing that this progress that we've been able to make to date is really a testament to the elected and staff leadership at each of our jurisdictions. I know Chris and Cadence have touched on as well. And it also demonstrates the strength and talent of the affordable housing development community. And so I want to thank you all for your implementation and support of the Affordable Housing Bond. And thank you for your time today. And so I think we may still have some time for questions and comments. And so Chris, Candace, and I are happy to address any of those. Thank you. I see a couple hands up. I'll start with Chair Harrington. Did you have a question?
I want to start with a humongous thank you. Back in 2017 and 2018, I was a Metro councilor, and I want to really call out Sheila Greenlaw Fink, Nathan Teskey, Comey Calavar, Katherine Gallian, many, many others who asked me to essentially take a leap of faith in my words, in my brain and in my heart. And you've made it happen. In 3 years, we have units leasing up now. We're able to tell our community, here is the pipeline that will be built between now and 2024. It's amazing. When we championed the bond measure, we were talking about a 5 to 7 year timeline. Here we are in year 3, people. You've made it happen. I am so grateful to you. If I was in the room, you would see me jumping out of my chair, just elated, wanting to hug all of you, because this is a huge accomplishment. Thank you so very much. And thank you for letting me articulate it versus just type it in the chat.
Absolutely. I'm tempted to end there, but we won't. We'll keep going. Catherine, you had your hand up.
I mean, I was just going to say the same thing. That was a very subdued, cerebral presentation of some amazing, incredible work that has happened. And it's great. I mean, I think it's, there's lots of work we've all talked about, this is the beginning and there's much more to be done, but just what's been done so far is so incredible, and it is worth it to take a moment and just be really proud of what's been done here. So I just thank you for saying it so much with so much more enthusiasm than even I could, Chair Harrington. I think if we weren't in Zoom with us all on mute, there would be like hooting and hollering or something. I mean, it's pretty incredible. So thank you. That's all.
Do we have any? We've got just like a minute or two if we've got one more burning question. I know for HAC members, we have another meeting after this. We're going to hold you a little bit longer. So maybe any other questions or comments from anyone else before we move into closing remarks? This morning went really fast. This has been amazing. Okay.
Well, maybe just one more. None of it is possible without the leadership of Chair Harrington and our mayors and the elected officials as well. So just the support that the elected officials give to the work is also incredible. So it takes all of us. The collaboration is amazing. There's just so much involved in the lift. So that's it.
Awesome. Thank you. Narendra, I see you have your hand up.
Yeah. Tremendous amount of work in progress. Reminds me of the Robert Frost poem, miles to go before I sleep, miles to go before I sleep. I think as a citizen of the community, when I see people on the streets, living on the streets, it just breaks my heart. While we have done tremendous amount of progress in bringing affordable units online and creating this pipeline, I don't think we should rest ourselves till that problem is resolved. That pipeline is, as was pointed out earlier in the panel, is going to continue to grow, the number of people coming on. But until we address that, we would have failed as a community. So I just hope that we can keep our focus not just on one side of the spectrum of the problem, but the other spectrum of the problem too. Yes, there are criterias and everything else needs to happen, but I just remind myself about the emergency room situation. When somebody shows up, get them covered, get them under some form of cover. Don't let them get on. So what can we do? So thank you.
Thank you. I don't see any more hands, and we are right at 12 o'clock. I've got one more poll question. Jacob, are you there? There he is. Okay, one more poll question. We have filled this morning with tons of information. So our question is, what will you do with what you've heard today? Really just, it's kind of a quick way of getting to what are you going to do with everything you've heard, and was this useful to you? So we'll do that. Caroline, you have your hand up. Do you want to ask a question while we do this quick poll before we throw it to Comey?
Oops, I was trying to answer the question and I pressed lower. Sorry.
No apologies necessary. I've been managing Zoom a little clunkily today. So, I see a question from Steve. How can we get a copy of the recording to share with colleagues and friends? Good question. I believe we have, and Jacob will nod at me, I believe we have everyone's email Jacob says yes, everyone's email who's here today. So we will send you an email with more information about that, whether we post it somewhere or whether, I'm sure we'll post it somewhere. We're not going to email you a recording. So we will get you that information. That's a really good question. Let's close out the poll. Go ahead, Jacob. Let's see. I can see it over here. Viewing poll results, all of the above. I'm going to look for more information. I'm going to share with friends and family. I'm going to talk to colleagues. I think for me, the biggest thing is always having the tools to bring these conversations forward to friends and family and other people, feeling like I'm well versed in this stuff. So I just want to say thank you to everyone who was here today. With that, Comey, are you there? If I look over here, I can see you. I think I can't hear Comey. Comey, are you muted? Still can't hear you. Do you want to try unplugging your headphones? I could hear you before. I have to say it's impressive if we get this far, and this is our first big Zoom glitch. We still can't hear you, Comey.
Well, if Comey is working on getting his stuff going, I'll just kind of step in. I think this was just such a wonderful day. We've learned so much. There's so much great information. We had diverging viewpoints, wonderful panelists. And I think, the opportunity again, just to thank all of our elected officials for their support. We can't do this work without you. And then just the staff who on a day-to-day, week-to-week, month-to-month basis are looking at innovative new ways of making this happen, finding ways to partner with everyone throughout our community. I've seen just so much happen in the last 2 to 3 years since I've gotten here, and it's really impressive. This is almost unnormal at the speed and velocity that we're all operating at right now. So I just, again, want to thank everybody. Thank you, Comey, for your leadership. And yeah, onwards into 2022, and we're going to do more great things. All right. Thank you.
Thank you, Josh.
Blue shot.
I couldn't have said it better. Thank you all. Thank you, elected officials, spending your day with us. You're all very special to us, to our work, but most especially is our panelists, Dr. Marisa Zapata. Let's give them a hand. Andy, Pat. Yes, all right. And what's Katrina, Shannon, Chris, and Cadence. Cadence is an old friend. He was my lawyer way back 15 years ago, getting me out of trouble. But thank you all. Thank you, elected officials. Thank you, HAC members. Thank you for spending your morning with us. We have work to do, especially with people suffering from mental illness. I think we heard today that while housing is a social determinant of health, we're not doing enough for the people suffering from mental illness. That's my big takeaway. And my second big takeaway is the engine light analogy. So thank you, Andy. Thank you, our speakers. It's been a pleasure spending your morning with us. and we'll get you notes and a summary. Bye-bye.
Thank you. HAC members, we will stay on and go into our 12:15, or no, yeah, 12:15. I think so. We have about a 10-minute break for HAC members, and then we'll come back together at 12:15.
I just want to also thank you guys too. It was great the way you guys set up the forum. You could tell that you guys put a lot of hard work into getting your guest speakers and whatnot. And to end on the Metro bond was wonderful. It was great news, but the information that I've learned from the earlier speakers has made an impressionable mark. And it's gonna just stick with me. And I'm grateful that you guys shared this with me.
Thank you. That's wonderful feedback. Thank you very much.
Well, thank you, Melissa. Thank you, Jacob. And let's give them a hand. They did all the heavy lifting. We appreciate you.